There are situations when a hammer toe worsens and the toe starts to move over and cross over the great toe. Let's talk about why that is and what there is to do about it. My name is Dr. Andrew Schneider and I'm a podiatrist in Houston, Texas. Hammer toes are commonly seen in all podiatry offices. Some are painful and other times you just may not like how they look. In today's video, I'll discuss why your second toe may cross over your great toe and what we can do about it. But before I get into it, please like, share, and subscribe to this video. Also, I wrote a book all about hammer toes. You can get it for free at www.hammertoebook.com. When we talk about a hammer toe, we most often think about the buckling of the joints of the toes. The toes take on a hammered shape and can become painful. Sometimes the toe just doesn't pop up. There are times when the second toe will start reaching for your great toe and even sit on top of it. This is problematic. For one, your shoe doesn't have room for your second toe sitting on top of the great toe. Because of that, there's lots of pressure inside the shoes. It makes the toes crowded and painful. One reason for the second toe to sit on top of the great toe is because of a bunion deformity. A bunion deformity occurs when the first metatarsal bone rotates and causes a bump to form on the side of your great toe joint. What also happens is the great toe shifts over towards the second toe. This often causes the great toe to slide underneath the second toe. The second toe ends up being forced on top of the great toe. Treatment for this involves not just a procedure for the second toe that's a hammer toe, but you also need to have the bunion addressed. Think of it this way. If you correct the hammer toe on the second toe and the great toe is still underneath the toe pushing it up, it's going to just do the exact same thing again. That's why a procedure needs to be done to correct the bunion deformity. This will straighten the great toe and stop it from pushing up the second toe. I recommend you check out my video series all about bunions for more information. Another reason that the second toe overlaps the great toe is because of a tear in a ligament beneath the joint between your foot and the toe. Every one of these joints has a capsule of ligaments that envelops the joint. The bottom part of the capsule is thickened, and we call it the plantar plate. A rupture of the plantar plate weakens the support of the toe. The toe is no longer able to be held down in a corrected position. As a result of this injury, the toe pops up and shifts over towards the great toe. Here's the thing. The toe can go crazy and shift up and over without a plantar plate injury. So in order to treat this properly, I need to be able to see if the integrity of the plantar plate is intact or if a rupture of the ligament is causing the problem. In order to assess the status of the plantar plate, I'll order an MRI. An MRI will allow me to examine the ligament to see if it's ruptured or not. This is very important to know since the treatment for a hammer toe differs from the treatment of a plantar plate injury. If it's in the early stages of a plantar plate injury, it's possible for the ligament to heal. In that case, I would tape your toe to maintain it in a proper position for the ligament to heal. This may be effective if a torn ligament is due to an injury. For instance, let's say you trip over a curb. The next day, you see that your second toe is up and over your great toe. That's the perfect time to come into the office for treatment. I'll make sure nothing is broken and we'll show you how to tape your foot to get that toe back down. For an acute injury like that, taping is an effective way to reposition the toe and allow the plantar plate to heal. If taping is successful in repairing the ligament, I'll recommend the use of a custom orthotic afterwards. This will shift pressure away from an already weakened ligament to prevent future problems from occurring. Unfortunately, most plantar plate injuries are not because of trauma and aren't so easily solved. In most cases, the plantar plate ligament progressively weakens over time, and when the ligament wears away and ruptured, well, think of it like a shredded rope. No amount of taping is going to allow it to heal on its own. Because of the position of the second toe, it's difficult to wear a shoe and the toe becomes painful. The best treatment for a plantar plate rupture is to repair it surgically. The surgical procedure to repair a plantar plate is involved. A surgical fracture is made in the second metatarsal in order to expose the torn ligament. At that time, the ligament is sutured and anchored to the first bone of the second toe. That's what brings the toe back into alignment. The fracture that I created in the metatarsal bone is then repaired with a screw. After the surgery, you'll be in a boot for a few weeks after, as well as having a dressing on your foot. Sutures typically come out in 2 to 3 weeks, and you're usually back to full activity in 8 to 12 weeks. That's a pretty big ordeal for a tiny ligament that becomes torn, but it's a necessary one. In next week's video, we'll discuss the non-surgical treatment for a hammer toe deformity. Please take a moment to like, comment, subscribe, and share on social media to help others find the information they need. Don't forget to pick up my free book all about hammer toes at www.hammertoebook.com. The link is at the top of the description below. If you've noticed that your second toe is starting to jump on top of your great toe, don't wait. Give us a call at the office and we'll get you in for an immediate appointment. The link is also in the description below. Thanks so much for watching and have a great day.